Hi, my name is Jessica Allen. I'm the physician assistant injector here at our North Raleigh location for Synergy. I've been injecting at Synergy for about 1.5 years now. Today I'll be talking about Botox. Botox is a neuromodulator that relaxes muscles, and in terms of treatment for muscle relaxation, we can get softening of wrinkles and lines. We can also even out uneven brows, open the eyes so they look more refreshed, correct a gummy smile, give you more show of your upper lip with a lip flip. We can also slim the lower face when we treat masseters, which can also help with pain from clenching and grinding. We can treat platysmal bands, which pull on the lower face. We can also treat excessive sweating. When you come in for treatment, you'll talk to your provider about whether or not you're a candidate for Botox. We'll get a thorough medical history. When we treat with Botox, it starts to kick in with 3 to 7 days. It's fully kicked in at 14 days. At that point, as a new patient, you'll come back to your provider for a follow-up. Botox will start to wear off at about 8 to 10 weeks. That's when we'll see more lines and wrinkles return. It's fully worn off at 12 weeks, and that's when we recommend repeating your treatment. Our model today is a first-time Botox patient. She and I have reviewed her medical history to make sure she's an appropriate candidate, so when you come for your Botox visit, this will be done for you as well. Contraindications for Botox are pregnancy, breastfeeding, and some rare neurological disorders. So Jen and I have already done an assessment together, and I took some pictures before treatment. So what I'm going to do is I'm going to treat her forehead with about 10 to 12 units, staying a little bit more on the conservative side for her first treatment until I really learn her face. I'm going to treat her glabella area, her 11s, with about 16 to 18 units of Botox, and then 9 units around each of her eyes to give her a soft, more refreshed look. When she comes back in 2 weeks, we'll take pictures again and look at her treatment, and we'll do any fine-tuning or dose adjustments if we need to at that time. Botox dosing in terms of units is different for everyone based off of their personal goals, muscle contraction, line and wrinkle pattern. Now we're going to get started with our Botox treatment. Now that we're finished with our treatment, we're going to review some post-treatment instructions. So we're going to make sure that Jennifer knows to keep her head above shoulders for 4 hours. No pressure to the areas that we've treated for 4 hours. Since we've treated her upper face, we want to avoid any kind of hat or visor. We also want to avoid cardiovascular activity or flying on a plane for 24 hours. This is so the Botox has a chance to be absorbed by the muscles. We can also then review that we may get little bruises with Botox. Those are little pinpoint bruises typically. They'll go away in about 5 to 7 days. In 24 hours, she can use makeup to cover up any bruising. Right away, you can have little red dots. It's just your body's natural histamine response to the injections, and that resolves in about 5 to 30 minutes. Now that we've finished our treatment and reviewed some post-treatment instructions, Jennifer, do you have any questions today?
Not today. You did a great job explaining everything.
Thank you. So thank you for attending my session. For any additional information, you can go to my speaker bio and click request follow-up. If you're ready to purchase, head to shop and purchase Botox for as low as $10 a unit. Be sure to enter the code GETRIDOFWRINKLES to receive 500 points. Have a great evening, and I hope to see you here at Synergy in my chair.